Hello everyone, today we're going to talk about something a little bit new, and that's instrument-assisted soft tissue mobilization. There are a lot of different brand names that this might go over. Both ASTM and Graston are some of the most famous, but there are a lot of different schools out there teaching these type of techniques. I want to cover a little bit of what we do with them in clinic, as well as how these tools work, because they're often a very useful tool to have at home as well. It might be something that might be beneficial to your program. Now, soft tissue mobilization in general kind of is all based off the same concept. What we're attempting to do is find areas of your muscle that have become a little bit more tonic. What that means is there are areas of your muscle that tend to stay on sometimes, especially in protective states like if you've just had an injury. Your muscle's trying to guard you, but that constant state of on can actually become relatively painful because it requires a lot of energy and can also build up some lactic acid inside the muscle itself, which is just like when you're working out, but in that chronic state can become extremely uncomfortable. Now, the nerves in that area respond very well to a lot of different modalities in order to help relax that muscle. Prescription muscle relaxants are a very common way to do this, as well as anti-inflammatory medication. However, exercise, stretching, hold, relax, and PNF techniques, and manual therapy can be other ways that we can provide different stimuli to those muscles to allow them to relax just as easily sometimes. What soft tissue mobilization in general is trying to do is provide a mechanical, novel stimulus to that area, allowing the nerves to react to something new and reset. The idea here is not necessarily that we're grinding in and causing an unpleasant sensation, although sometimes that may be what's needed in order to get the muscle to reset. Generally, what we're trying to do is allow that muscle to sense something new so that it can react in a different way. Different types of manual mobilization will attempt to elicit this in different fashions because everybody's nervous system and muscles respond slightly differently. A very common technique used, however, is the tool mobilization. Now, science has changed over the past couple of years, and what we've discovered we do now as opposed to what we thought we were doing when we first came out with these tools. The initial thought was that we were actually going to be grinding away at broken up tissue so that we can realign it properly. But the more research that we do, the more we find out that we really are just reacting nerves to novel stimulus. So what we've learned is instead of having to grind heavily, these can actually be used very effectively to decrease the amount of force that we can apply through sensation. In other words, when I'm using my hands, there's a certain amount of force I have to grade in order to just feel your muscles. Because of the reverberation of a lot of these tools, it's a lot more easy for me to apply that stimulus without applying quite as much force. Also, there's a nice broad breadth to a lot of these tools that allows me to contact more areas of skin, putting less general pressure that would be harder for me to do effectively on my hands without damaging my own joints. It's one of the reasons I love tissue mobilization with tools, is that it's a little bit safer for me as a therapist to do constantly throughout the day, while still providing a very effective treatment. Another common myth about these tools is that they are more effective than manual therapy. However, as many massage therapists will tell you, their hands are some of their most valuable tools. And the more research we do, the more we find that most manual therapy is created relatively equal. And even though these tools can be great and useful tools, they're not necessarily anything more than that. It's another thing in my toolbox for me to utilize. But beyond the science, these can be very, very nice for people who have more sensitivity to a region. Like I said, if I'm able to apply a little bit less force and still get that novel stimulus, it can be a nice way for people who have a really, really tonic and guarded area to allow them to have that new novel stimulus and relax a little bit better. Also, a lot of these tools have specially built areas that allow me to hit some of the intrinsic smaller areas without quite applying as much force as well, which can be a lot more comfortable for many patients. Another useful thing that this allows me to do is have a little bit more time. Because all manual therapy that goes through my hand directly takes a little bit of a toll, I tend to fatigue a little bit easier and can't spend quite as long without training specifically for that. And this allows me to go through pretty much every patient in the day without fatiguing out. It's extremely nice, especially for some of the tougher and more less mobile tissues like the IT band and the plantar fascia on our feet. This can be very useful for people in general in those areas as well, just because it allows them to do it at home. A lot of the manual techniques that we learn in school as physical therapists, massage therapists, and a lot of the healthcare professions do require a little bit of expertise. However, the different certifications that we get for this are actually relatively easy, and there are a lot of materials online that you can use at home in order to learn some of the ways that we do things in clinic. I'm actually going to provide a link to one of my favorite websites below because he does provide a free service and they'll allow you to learn some of the basic techniques that we use with these. When it comes to choosing tools, there are a lot of different opinions on the matter. I personally like the metal tools a little bit better. Diagnostically, it does allow me to feel a little bit more reverberation as I'm going over areas, just like when I'm using my hands, which means it's easier for me to detect some of those tonic areas. It essentially feels like a bunch of speed bumps. Now, it is important to note that while some people will encourage entirely using their own tools for diagnostic purposes, a lot of the times you will find areas that do have that speed bumpy feel, like my forearm, without any injury. I've just been beating up myself for many years with a lot of different sports, and while my tissue has adapted to that, there's no pain in this region and there's no evidence of any injury. So even though I'm able to diagnose an area that I might think is abnormal with this kind of tool, it doesn't necessarily mean that there's anything wrong with it, just that my body's adapted a little bit differently. The other advantage of metal tools, especially in clinical practice for us, is that they're easy to disinfect between patients. Plastic tools and some of the more porous materials that are sometimes used for this type of instrument tend to be a little bit harder to disinfect because of that porous nature. However, if you're using this for home use, there's nothing wrong with that because you're going to be able to scrub it on your own between your own uses. As long as you're not rubbing hard enough to abrade your skin, you should be able to be okay with pretty much any of the other tools on the market. Now, there are a lot of different options for you. There are different grades of plastics, and some of the older tools that were used in Chinese medicine, like jade and buffalo horn, are still very popular today because they've been used for such a long time with such good efficacy. There's nothing particularly wrong with them, and very often the price point is a lot more friendly to somebody who's going to be doing this themselves at home and only working on themselves. The shapes of the tools very much just affect how you're going to work on different tissues. These longer edges are great for when I'm doing longer, broader strokes over bigger areas of the body, like the thigh or across someone's back. However, these finer points are very useful for smaller areas. So if you are working on something specific, helping choose your tool by what types of edges are going to be available to you can be very nice. Now, I happen to like tools like this with multiple edges because I tend to travel a fair amount when I'm working on athletes or dancers or even myself at home. And it's nice not to have to carry a full kit. You may see many therapists, however, that do have a full suitcase full of different tools that allow them to hit different edges more easily. There's nothing wrong with that at all. This tool specifically fits my hand great, but may not fit someone like that. And therefore, having a bunch of different tools that fit their hand individually for each surface might be a lot more useful. At home, if you don't want to get the full kit that costs over $4,000 sometimes, finding a tool that fits you well or finding a tool that has multiple edges might be a lot more useful. And the same is going to be true for people like myself who tend to travel a little bit more but still need these tools for multiple circumstances. If you have any other questions about these different methods or what we do with them, why we do it, or whether or not you'd be a good candidate, feel free to give us a call. We'll be happy to discuss it with you and tell you a little bit more about what we do. Have a great day, guys.